Here's another stark reminder as we deal with major social issues. We're still in the midst of a pandemic. For the third time this week, Dallas County broke its single-day record yesterday. Nearly 300 new cases were reported. It comes as the state plans to significantly ramp up testing next week in areas that are predominantly Black and Hispanic. Joining us this morning is Dr. Carlo, CEO of Prism Health North Texas, on the state's COVID-19 task force. Good morning to you, Dr. Carlo.
Good morning.
How significant are the increased cases, and are recovery numbers the bigger story at this point?
Well, certainly this week was a lot of new case numbers for particularly the Dallas area of the state. The numbers are continuing to go up, and across virtually the world, the numbers continue to increase. So I think it's telling us that there is still a concern with coronavirus. Even as we start relaxing more and more of our physical distancing measures, the cases are speaking for themselves, and I think we still need to be worried about what we saw this week.
As you said, speaking on what we saw this week, we did see people close together, many not wearing face masks. Are you expecting a spike in COVID-19 cases in the coming weeks because of these protests? And these protests are needed, right? But are you expecting to see a spike?
Well, I think that the good thing about the protests themselves, the fact that they are outside, really, I think, lowers the risk of transmission. And, we've seen a lot of the folks out there wearing masks, which we think is also a good thing as well. A lot of movement as well, so not stationary in one place and not sticking around one or two people at the same time for a long period. And, I think for the most part, this is a pretty low risk type of environment. I'm honestly more concerned about, as we're going through more and more the relaxation of our physical distancing measures, and looking at our indoor facilities as we, increase the capacity. Does that, tell people that it's, you can get back to doing the old ways of congregating, and that's simply not the case right now.
Yeah, I do want to talk about that as things do begin to reopen. I feel like there is a group of people out there that forget that, hey, we are in the midst of a pandemic. What are your words of advice?
Well, absolutely. I think this is not the time to be complacent. And if anything, what I hope this does, as we continue to go about our lives, that we really do the individual precautions and keep those, if not at this level, or even more important, because, if we're going to be out and about and doing things, then absolutely trying to stay 6 feet away from one another, frequent hand washing, wearing that mask, and wearing that mask correctly, those things make a huge difference. And so, as we go through this together, I just hope that, those measures certainly don't stop and perhaps increase as we're doing more and more of going out and going into businesses and things like that.
Doctor, I know that this might be a loaded question, but we're hearing more about minority testing and it making a difference. But why was this even an issue?
Well, it's a huge issue, particularly in Texas. The first thing is healthcare access in general. So we know our minority communities and lower socioeconomic groups do not have the equal access to healthcare as everybody does. So the first thing is where you can even get a test if you don't have a primary care provider or a healthcare provider. So that's number one. Number two, we know that our minority communities are experiencing higher rates of coronavirus infections and severe coronavirus infections. And so we see that there's a higher risk, not just in the numbers of cases, but also in the risk of hospitalizations and unfortunately deaths. And we think this is for a lot of reasons. Mainly it has to do with higher rates of chronic illnesses that put you at higher risk, such as diabetes and high blood pressure. So I think it's a completely important message to say that we need to make more effort around our communities to address health inequities at the very, very fundamental part. But this does start with making sure we address this from a perspective of making sure there's enough tests out there for those that need it.
Dr. Carlo, thank you so much for joining us this morning and shedding some perspective on everything that's been happening.
Thank you. Stay safe.